Hello, I'm Dr. Rohini. I'm working as IVF consultant in Cloudnine Hospital's Varthur Road, Bangalore. Today I'm going to talk about some of the precautions and things that you should do after your embryo transfer. First thing that we tell all our patients is that they should be optimistic about their result and not take too much of stress, because stress can activate the stress hormones in your body and have a negative impact on your implantation. So to avoid stress, you should do yoga, do meditation, have adequate sleep. Now the next thing that patients commonly ask is, should we be on complete bed rest? No, not at all. So after embryo transfer, we advise patients to be at bed rest for just 20 to 30 minutes. After that, you can carry on with your routine activities. But yes, we do advise you to avoid exertion. You should not do aerobics. You can do walking around 20 to 30 minutes in a day, but don't do any strenuous exercise. Don't do strenuous traveling. Now, the most important thing is that you should follow all the medications that doctor has given you. So you should keep all the medications written in a nice chart. You should make sure that you don't miss any of it, and you should take all these injections or hormones that are given. Usually progesterone and estrogen tablets or injections are given. This has to be taken on time. So you have to be stress-free, take rest, at the same time be active, take your medications on time. So apart from this, you should also have a healthy diet. That is, you should take lot of high-fibre diet, take lot of green vegetables, because what happens is all these hormones, they can cause lot of constipation. And when you have constipation, you will tend to strain and increase the abdominal pressure, which can have a negative impact on the embryos. So it's important that you take high-fibre diet. Now apart from this, I will tell you some of the things that you should not do. First of all, avoid alcohol at any cost, avoid smoking, and avoid any strenuous activity, and also avoid sexual intercourse when you are waiting for your embryo transfer results. Now next, when is the time that you should check for your pregnancy? So pregnancy test can come positive as early as 9th day after the embryo transfer, but ideally we tell the patients to check for their beta-HCG, that is the blood pregnancy hormone test, usually after 12 to 14 days after the embryo transfer. So usually any level which is more than 25 is considered directly positive for pregnancy, and less than 5 is considered as negative. The level 5 to 25 is somewhat like a grey area, and in that case you will require a repeat pregnancy hormone test. And you should never stop any of the medications without consulting with your fertility specialist.